And welcome to the broadcast. Our sign language interpreter tonight is Njoki Shege. Vicky?
Well, tonight we begin the bulletin by painting the picture of the COVID-19 situation in the country. That's
right. Now, a day after Health Cabinet Secretary Mutahi Kagwe warned that hospitals in the capital are being stretched thin due to a surge in new infections, the main government COVID-19 center at Mbagathi is saturated. All 48 beds occupied, forcing the hospital to convert a ward meant for TB patients into a COVID-19 holding ward. And as Chemutai Goin reports, the World Health Organization is warning that gains made in the battle against COVID-19 could be lost if countries relax in enforcing protocols.
This here is the infectious disease unit at the Mbagathi hospital. This particular room is a ward meant for TB patients, now repurposed into a holding area for COVID-19 patients, awaiting space in the COVID ward, which is full. This woman's condition is worse than the others. She's, however, lucky to have an oxygen cylinder. Others will have to wait longer, since the 48-bed capacity COVID ward has only 25 cylinders, which are all in use. And as soon as one patient is off the cylinder, another goes in. The irony, however, is this. This tent, which was meant to be a makeshift COVID ward to handle additional patients with a capacity of 120 beds, is unequipped 1 year later. Construction tools are still lying around. Inside the tent are these beds that would have given patients hope in the war against the invisible enemy, but here they lie idle. Never mind the fact that hospitals around the capital are choking with the surge in infections and high number of patients requiring urgent medical care. Sources within the hospital revealed to us the 48 patients are under the care of only 2 nurses. Despite the fatigue, they are the patients' only hope. But they are also putting their lives at risk owing to the lack of personal protective equipment. Seemingly aware that health workers are struggling, Health CS Mutahi Kagwe directed KEMSA to supply county governments with the requisite PPEs.
NAC has directed that it doesn't matter whether a county has paid his account or not, let every county be given the PPEs that are required for protection of our people.
But even as the battle with COVID goes on in hospitals, police were out on Saturday night, effecting orders to arrest those flouting COVID protocols, including the curfew. Many road users along Thika Road caught off guard when the clock struck 10 p.m. Commencement period for the curfew, police mounted roadblocks and no road user was allowed to pass.
Unaenda wapi? Kawa West. Sasa kama unaenda Kawa West, hii gari ya driver nani? Ako wapi driver? Gari yake iko mbele pale. Hakuna shida. What we are going to do, huyo mtoto nitampeleka wewe na mtoto napeleka wewe na gari yangu mpaka West. Hii ya bwana yako itakaa hapa mpaka.
This woman and her child were among those pleading with the officers to allow them to go home. And in seemingly what appeared to be a humanized service, the OCPD Kasarani Peter Mwanzo offered to use his vehicle to ferry all mothers and their children home. This man, who was injured and was headed to hospital, was among those caught in the traffic that had stretched 4 kilometers. Those who stayed behind, braving the chilly night weather, had this bonfire to warm them up. The World Health Organization Director General Tedros Adhanom had Friday warned that due to the emergence of the Delta variant, gains that had been made were now at risk if nations relax in enforcing protocols.
The rise is also driven by increased social mixing and mobility, the inconsistent use of public health and social measures, and inequitable vaccine use.
In the last 24 hours, Kenya recorded a drop in the positivity rate to 9% from 15.6% Saturday, with 467 people confirmed to have contracted the virus. 5 counties were categorized in the red zone, meaning counties with the highest numbers. 1,475 patients are receiving treatment in various facilities across the country, 186 of those in the intensive care, while 46 were on ventilatory support, 529 on supplemental oxygen. 15 late deaths were also recorded, pushing the death toll to 3,946. Chemutai Goin, Citizen TV.